Good evening, everyone, and thank you so much for joining us for tonight's discussion on unusual medical cures from the 19th century. My name is Emily Hill-Wright, and I'm the Director of Operations at the Merchants House Museum, New York City's only family home to be preserved intact both inside and out from the 19th century. Home to the Treadwell family and their Irish servants for nearly 100 years, the Merchants House is complete with the family's original furnishings and personal possessions. I'd like to thank Village Preservation for co-sponsoring tonight's program. As many of you know, for the last 12 years, the Merchants House has been fighting proposed development next door, construction that is guaranteed to cause irreparable damage to our landmark building and will force us to close the museum to the public for at least 2 years. At the end of last year, in a shocking betrayal, the Landmarks Preservation Commission voted to approve the development in spite of overwhelming and unanimous opposition from the community, from preservation organizations, from public officials, engineers, and preservation architects. This disastrous vote is a warning to every other landmark in New York City. If this can happen to the Merchants House, the very first building in Manhattan designated a New York City landmark in 1965, then every landmark in New York is at risk. Earlier this year, we launched a letter writing campaign urging the Adams administration and the Department of Buildings to step in to protect the Merchants House, a city-owned interior and exterior landmark, and a beloved and irreplaceable educational and community resource. Please take just 30 seconds to sign your name and submit a letter. I'm posting the direct link here in the chat. If you click it now, you will be able to submit your letter before our program tonight even begins. And yes, you can submit a letter even if you don't live in New York City. Tourism, as I'm sure you know, is hugely important here in the city. And so it is really important that the administration hear from supporters from all over. Before we begin tonight, during tonight's talk, please feel free to use the Q&A feature at the bottom of your screen to ask any questions. We will have time to address some questions at the end of the program. I am just delighted to welcome tonight our speakers, Merchants House volunteers, Matilda Garrido and Ashley Semrick. Matilda is a certified thanatologist and holds dual master's degrees in bioethics and thanatology, the study of death, dying, and bereavement. She has worked extensively with the dying and bereaved. She volunteers at the Merchants House in various capacities, including as co-host of our monthly paranormal roundtable discussion program, In the Spirit of Science. Ashley is an educator who has been teaching in New York City classrooms and museums for over 14 years. When not teaching her 4th grade class, she visits classrooms all over the city as a costumed interpreter and educator. As a licensed New York City tour guide, Ashley also leads tours at the Merchants House, exploring 19th century history, as well as our resident ghosts. So welcome, Matilda and Ashley. Thank you so much for being here.
Thank you, Emily. And thank you to Village Preservation for co-sponsoring this program. I'm so excited to be doing this program with Ashley. Ashley and I have done ghost tours together, and when I was thinking about doing this program, I just figured that she would be a perfect person to collaborate with. So I'm so excited to be here with you, Ashley.
Thank you. I'm looking forward to all that we have to share tonight.
Yeah. We're going to, I just want to clarify a couple of things before we get started. So we are going to be talking about leeches and maggots and wounds, and we're going to be talking about the female anatomy and giving birth and things like that. So this is just a generalized trigger warning if anybody has small children that they think may be upset by some of the imagery. There is one fairly graphic photo that I'm going to show, and I'll let everybody know before I actually put that on the screen, just in case you have a tolerance limit that might be reached with that. And one last thing I wanted to clarify too is that we're not going to be talking about patent medicines tonight. Patent medicines is a subject that could take up 5-hour-long programs, and hopefully we'll be able to do a show all about patent medicines at a later date, but they were an important part of the, what I want to call, mistreatment of illness in the 19th century. So I will start off. I'm going to start off talking about leeches and maggots, two therapies from the 19th century and even earlier than the 19th century that actually are still in use today. And we'll talk all about that. And I'll start by sharing my screen. Okay, so leech therapy came out of a therapy called bloodletting, which had been used for centuries. Really, up until the middle of the 19th century, it was still believed that illnesses were caused by an imbalance of fluids in the body. The fluids were called the four humors, and they were blood, phlegm, black bile, and yellow bile. And really the only one of those that we have sort of any control over is the blood, because we can't, without surgical techniques, reach bile or phlegm. So bleeding, it was thought, could restore balance to the body. It had been used since Egyptian times, and George Washington actually died of bloodletting. He went out one day, caught a cold in the field, came home, the doctor was called, and George Washington said, "I want to be bloodlet." And he actually lost 25% of the blood in his body, and he died. He died from bloodletting. So, you know, we're just glad that we're not using bloodletting anymore, although it is still used occasionally for the treatment of hemochromatosis, which is a genetic proclivity to build up iron in the blood. So people who have that will go to, in a very controlled environment, and they will actually donate blood on a regular basis through a special machine that actually takes out the excess iron in their blood. So we're still using a form of bloodletting, but very, very restricted and only in certain circumstances.
Matilda, I wonder if I can't interrupt you for just a second as you're speaking and ask, I mean, I feel like this is a little known fact about George Washington, that is what contributed to his demise. How old was he when this happened? And did that in general have an impact on how folks saw bloodletting in early America?
So I believe that, I think George Washington was in his early 60s when he died, and I don't think it was generally recognized at the time that he died from bloodletting. You know, he was at that time considered an older person, and he had come down with some kind of illness. And back then, you know, people just really, you know, people could die from a fever or the flu, or if they were weakened, if their immune system was weakened, even from a cold. So I don't think it was realized until later that that actually was the cause of his death. Yeah, I know. I never knew that about him until I started researching this. So I thought that that was pretty interesting. And what I thought was even more interesting is that he kept encouraging them to take more and more and more blood from him. You know, I think, like, you know, I have noticed when I've given blood, I have actually noticed that there's a slight euphoric feeling that comes when you are losing a you know, like some of your blood, right? Like, I don't know if that's the body just naturally kicking in. So I wonder, I mean, who knows if he was entered into some kind of hallucinogenic state? I don't know. But here's another interesting fact about bloodletting. So back in the Middle Ages, doctors did not perform surgery. The people who performed surgery were called barber surgeons. They literally were the people that cut hair and shaved you. And they also did surgery. And so they did bloodletting in the Middle Ages. And that's where the red stripe on the barber pole comes from. Who knew? Right?
How gruesome. That gruesome history holding on.
Exactly. So bloodletting led into leech therapy. So leech therapy became very, very popular in the 19th century. People still were kind of buying into this idea that blood could be drawn or let out in order to balance the body and promote healing. But leeches were used for everything. I mean, one British physician named Thomas Tanner wrote that applying them to the anus could cure obesity. These leeches were really harvested from ponds and rivers, and they sometimes carried infections. So people would occasionally get infected through leech therapy, through the use of leech therapy. You know, when that started happening, leech farms sprang up and people started breeding leeches for medicinal use. They were also used as part of the principle of homeopathy as a counter-irritative. And just like we think now, like bee sting therapy, right, might promote provoke the immune system into beginning to heal itself. So they were used for that as well. They went out of favor when actually there was a shortage of leeches because people were using them so much. And so there were countries were refusing to import leeches because they wanted to keep the leeches for their own populations to use. But they fell out of favor with the discovery of germ therapy. And so people realized, so this whole theory about the four humors went out of favor. But they began to be used again in the 1980s and really much more thoroughly researched. And leech therapy is now actively still used in hospitals. We've learned so much about leeches and why they actually do promote healing. So when a leech is applied, it secretes an anticoagulant and an antibacterial substance into the skin. Leeches are usually used for areas of venous congestion, like when there's like on a surgery site and there's a blood clot and the blood is not flowing. If leeches are applied, they will inject the anticoagulant, which will thin the blood and will promote the flow of the blood, and also they also emit something that's called a vasodilator, which makes the blood vessel widen, which also increases blood flow. You don't feel the bite of the leech because they also secrete an analgesic, so it's a little bit of a painkiller. Yes.
I'm blown away by how many things leeches can do. And I'm also thinking now that we're in an era where the science of biomimicry and scientists are actually turning back to nature to cue from and how leeches are so complex and they have all of these properties that help to heal. I'm thinking of that century where we essentially weren't using them. And I wonder now if the tone or the sort of the thought of leeches, we say, ugh, but is that dissipating because of their healing properties?
Well, so it's interesting. They are becoming more widely used. I actually read an article in a nursing journal that advised a nurse who is administering leech therapy, prepare the patient for the possibility that a leech may migrate off the attachment site and tell them to alert you if this happens. So basically, what they do actually now is they sort of contain the leech within a cut. I have a slide of that. This is a 19th century leech jar. Leeches were kept in these beautiful decorative jars, which are now highly collectible. You can buy them on eBay. So here's someone currently getting leech therapy. So you see that the nurse is containing the leech, right? The leech will latch on and it will stay there for about anywhere between a half an hour and an hour. And when it's fully engorged, it will fall off. So it's kind of a self-limiting therapy. If the leech does not latch on, it means that there is no congestion in that particular vein.
So they're diagnostic as well.
Exactly. Tissue flap transplants, like people who have surgery or are having a reattached limb or something like that. Leeches help join the pieces of skin together. because of the substances that they excrete, they promote blood flow in those areas. I think it's really incredible. It's really incredible. And we're talking about weird 19th century cures, but I think some of these things are not so weird. And just wait until I start talking about maggots, which are also still used. Leeches are really inexpensive to breed. They're bred in sterile conditions. They are used once and then they're destroyed. So we're not reusing leeches. That did happen in the 19th century. And that's probably another reason why people would get infected during leech therapy, is that the leech could transfer an infection from one person to another. Yeah, the most common reason that skin graft surgeries fail is because of venous insufficiency, which means there isn't enough blood flow. So, yeah, it's pretty incredible.
I think I would let them do leeches on me. Maybe if I didn't know they were doing leeches, if I needed them, they could just.
Yeah. Yeah. Should we move on to maggots?
Please.
Okay, so maggot therapy has also been used for centuries. Aboriginal tribes used maggot therapy, but really maggot therapy came into fashion in Europe and in America during the Civil War, and in Europe during the Napoleonic Wars, when battlefield physicians discovered that soldiers who'd been injured on the battlefield and not attended to by a doctor for a number of hours or sometimes days would have terrible, terrible wounds, but the wounds would not be infected. And the rest of their body would not be in the kind of shock that the doctors would have expected from the extent of the wounding. And the reason this happened, the reason this is because on the battlefield, flies would come, they would lay eggs, and the maggots would surround the wound of the soldier. And maggots only eat necrotic flesh. They don't eat live flesh. So when you have a wound and the flesh becomes necrotic and infected, and a maggot comes and eats that infected flesh, it prevents the infection from spreading to the rest of your body.
Oh my gosh.
Yeah. Maggots also do many other great things, just like leeches.
Are you going to tell us that they also have properties for healing, not just eating the dead flesh? Amazing.
So they do. So their saliva is a disinfectant, and it's also growth stimulating. So it encourages the regrowth of dead flesh, right? It promotes healing in that way. Also, when you have a wound and the wound is infected, it's covered with something that's called a biofilm, which is like, you can't see it. It's just like a clear layer of infectious, cells, infectious cells. Maggots are the only therapy that can completely destroy the infected biofilm. And another great thing about maggots with skin infections is that you don't run the risk of people becoming immune to the antibiotics, right? Which is a huge problem these days. That antibiotic resistance is really, especially in cases of MRSA or the flesh-eating disease. This is one reason why people die of necrotizing fasciitis, is because they are antibiotic resistant. So if you're using maggots, you don't ever have to deal with that. So maggot therapy went out of fashion in the 1940s as antibiotics were introduced, and it was reintroduced into the 1980s when we started to begin to experience antibiotic resistance. I'm not sure who decided to reintroduce them. They are now bred in, completely sterile conditions. They one other thing I neglected to mention about them is when portions, not only skin, but when portions of a bone are dead, if you have an open wound and the bone is exposed, portions of the bone are dead, they actually help to bond the dead bone with the live bone. So it's like incredible how they can't like sort of bring the dead bone back to life, but they create the structure to help the living bone begin to attach to other living bone.
That's incredible. And I see from this comical seal that the maggots are by prescription use only.
Yes, by
Don't
prescription
go
use
messing
only.
around with, don't go messing around without a prescription.
No, no, no. And here's the shot that is a trigger warning. Okay, this is somewhat graphic.
I will say,
Oh
but
no.
also,
Oh no, actually this is not the graphic
important.
one.
This is important.
This is very important. So if you go in for contemporary maggot therapy, you are not they don't just put maggots on a wound. They come in this little what's called a bio bag. It's like a little tea bag. And the bag is put onto your wound and then covered. So you're not witnessing what's going on really. And they're not crawling all over you. Even though they generally would not migrate because they're only interested in necrotic flesh. They're not interested in living flesh. So now we work with bio-bagged maggots, again, raised in sterile conditions. And this next slide is the trigger warning slide. So this is a person with diabetic leg sores that had not healed. These are actually 2 years old in the before shot. The middle shot is in the middle of maggot therapy, and the last shot is after the maggot therapy has been completed. So you can see not only are the wounds healed, the scarring is minimal.
I was going to say, those are not shallow wounds. That looks
No.
like advertising flesh. Those look like they go very deep. And so again, like we saw with the leeches, it's not just the eating the dead flesh, it's that there's actually healing properties for the flesh to rebuild.
Exactly. Yeah. So, I mean, I think that I would, if it was offered to me, if I needed it, I mean, I think I've never had a wound that has refused to heal, but it's a huge problem for people. Sometimes people who have surgery, they have a wound that refuses to heal. It can go on for years and they have to use all kinds of things like wound vacuums and things like that. When you have a therapy like this that not only kills infection, but also promotes growth and bonding of the skin, and it's naturally occurring and it's inexpensive and there's no risk of a bad reaction to an antibiotic or antibiotic resistance developing or anything like that. I mean, it's pretty incredible.
It's something that I think we cringe at, but then yet still has life today.
Yeah, right, exactly. So that'll conclude the first part of our program.
Now it's
Ashley, we'll now go on to you. I'll stop sharing my screen.
Great.
We'll go on to you.
All right, folks. Well, we're going to talk now about hydropathy, also known as hydrotherapy or the water cure, which of course is also still used today. But first, we're going to take it way back in time, even to ancient Greece. And let's see my next slide here. This painting is from a Japanese bathhouse for women and children. And the water cure is exactly what it sounds like. It's water cures you. And a number of ways throughout the many, many eras of time, water has been used as a cure. We're going to focus specifically tonight on the 19th century, where water cure sort of exploded as something. And this was just across town from the merchant's house, where the merchant's house stands now, was a hydropathic and hygienic institute. Fascinatingly enough, as the water cure, which began in Europe and then caught, went like lightning here in the United States, the early United States, it was one of the few medical professions where women equaled the number of men as doctors or professionals in administering and learning about what water cures did. And you can see this, we're going to talk a little bit more about the Treadwells and water cure, but this was just down the road from them. And first one opened in 1853, so smack in the mid-century. Now, what was a water cure? Well, they tended to be everything from what you might think of as a languid, warm bath to make you feel better with sore muscles to, oh, I don't know, force feeding water down your throat so it would push the poison from your system. This doesn't look therapeutic to me. It looks,
No, and I have a question, Ashley. I'm
yeah.
thinking of Kellogg. So are colonics considered water therapy?
Oh yeah, yeah. There
Mm,
was
mhm.
they would put water. You name an orifice, they were going to put water in at some point to try to cure you of something. This, as you can see, looks a little bit like waterboarding. And then
Yeah.
another great image that I found when doing research was, oh, I'm going to click back really quick because this is a I love this quote here. Oh, now I've just touched too many things and I'm annotating. Hang on one second. We've got no one should undertake to prescribe or use water to produce any powerful impression on the body without well understanding what they are to do. Don't be taking that water and doing crazy things with it.
No.
But let it always be heeded that the agent is one of power. It can be made to cause great injury. Well, yeah, if you're doing what happened to that guy in the previous slide.
Yeah.
um,
It looked like he was going to explode from
he
the
really
water.
did. And this is a bit of like a cartoon here that this is someone getting a douche cure, right? Like a shower to cure them. But one of the things you would do is get water dumped on you of varying temperatures. And here's a cure. This was a mid-century cure for someone who was experiencing deafness. And let's just look into the cure. So the treatment was as follows: morning, wet sheet, and then a plunge bath with rubbing. Noon, head bath, so just your head is wet, and then a walk, then another wet sheet, followed by more rubbing, and then a dripping sheet, which is like a sheet but more wet, followed by a sitz bath, and then in the afternoon, another head bath, a walk, another wet sheet, a plunge bath, hand rubbing with wet sheets, and then at night, another head bath. And this person said that his hearing started to come back. I really wonder what getting rubbed with a wet sheet does for your hearing, but being
Yeah.
rubbed with wet sheets, being bound in wet sheets, going to bed in wet clothes, these were all part of the hydrotherapy, along with drinking the mineral water, sitting in the mineral water, bathing with it. And then especially when it came to women, of course, there was specialized treatment for the ladies because ladies,
Mhm.
as we know, are hysterical. And this is
Right.
this is a very popular book that kept coming over and over to my eyes while I was researching. You can buy it on abebooks.com if you'd like to add it to your collection. It's not just about the water cure, it's all things of how to be a great lady in the 19th century, but there's so much about the water cure and how it can cure your hysterics.
Mm.
Because look at her, she's hysterical, right?
She's totally hysterical. Maybe because she's having water poured all over her.
It's true. And you want to pour the water until the patient becomes chilly and revives. Never use
Mm.
anything but cold water for a hysterical fit unless the party turned very cold. And then you should discontinue it and apply warmth to the feet. So, comfortable, not always. Effective, questionable. But we have a few people who our audience may know about that they've heard of, including our own Julia Treadwell, one of
Mhm.
Seabury and Eliza's daughters. Now, we have in the archive at the museum information that lets us know that Julia did take a water cure upstate. And we
Mhm.
don't know, we know it was in August, but we're not sure what year it was. She didn't put the year on her letter. And she expressed that it was very lovely and she'd felt better after baths, but that she was also quite lonely. And
Mhm.
so it seems a very bucolic setting. We're not sure what Julia went to get the water cure for, but we
Mhm.
do know she lived to age 76. So I guess her water cure maybe wasn't as aggressive as some of those other slides that we've seen. She did just fine. She lived until 1909.
Mhm.
And another famous hydropathy champion is New York's own John Roebling. So as folks may know, he was the designer of the Brooklyn Bridge. Unfortunately for John, he did not see to live the bridge built. He was such an ardent hydrotherapist that it was said he reviled doctors. He didn't want them in the house. He didn't want to talk to them. He thought they were evil. He comes from a place in Europe, Saxony, where there was a lot of mineral springs. And so he came of age thinking that water was intrinsically healing. And Matilda, do you remember what happened to John Roebling? Why he ended up hurt and needing the water cure?
No, I don't.
So imagine the bridge is not yet built, and he's standing on the edge of the East River with his son, who also happens to be an engineer, Washington. And John Roebling is literally standing on a piling just, on the river's edge, and a ferry boat is coming in, and he doesn't move in time, and the ferry hits him and smashes his foot and really ruins his foot. And the family is living in Brooklyn Heights at this time. So they cart him off to Washington and Emily Roebling's house, where he refuses medical treatment. And he's got several toes that need to be amputated. So he demands it be done only with water as a pain treatment. And then he bandages his toes, amputated toe stubs himself, and will only take a water cure.
Oh, so what happened?
Well, you can imagine it happened slowly, because gangrene often does. But it took
too bad he didn't have maggots.
I think the maggots probably would have helped, but that's not water.
No, and the water would have washed the maggots away anyway.
I know. So John Roebling actually succumbs to gangrene, completely preventable illness, before any actual work is done on the Brooklyn Bridge. Because he was such a devotee of hydrotherapy, he refused any and all medical treatment. Truly one of the greatest minds of our generation, lost to that belief.
Wow.
And then we've got his son, who in a really great book by Erica Wagner, Chief Engineer Washington Roebling, man who built the Brooklyn Bridge, one of the quotes is, "When one of John Roebling's children fell ill, the first impulse was to conceal it from him, because the torture of his water treatment was worse than death," Washington remembered. So even his own son, who was also an engineer, was terrified of this situation that his father believed in. Now, the problem is that our good dear Washington Roebling, he took on building the Brooklyn Bridge after John succumbed to his hydrotherapy techniques. And as some folks might know, the Brooklyn Bridge towers rest on caissons, and those caissons had to be dug out, and the workers in those caissons became very sick. It was compression sickness. We called it the bends. We know now it's nitrogen bubbles in the blood, and that coming up slowly would have changed it. Well, Washington fell ill to this same disease that a lot of his workers did. And in order to treat it, guess what he did? Reverted back to what old Pop said, and he took himself to Germany, to the healing spas, to try to cure his bends. We don't know if it worked. He had fits of anxiety and nervousness and depression basically his entire life, but he did live a long and healthy life. So maybe there's something to be said for the mineral waters, because today you can go just up to Rochester. They've got a mineral springs bath, and this is straight from their website. Their mineral water is available at this time, because if it's unavailable, all baths are scheduled with tap water. So maybe, who knows? But I wanted to show you some of the things you could get at this. You can get your basic bath, which is just immersion, or you can get a peat bath. With anyone who's done that, it's actually quite lovely. But wait, here's where we're bringing it back around. If you desire to be wrapped in a wet sheet and rubbed, they're gonna do it for you. And it's only $25. So you can see it increases circulation to your internal organs. And after you dry off, you get on the massage table and they'll wrap you in a wet sheet. And the sheet wrap is encouraged to boost the body's healing response. There was this consistent belief that not only are we putting water in our orifices to clear things up, but just absorbing it through our skin was healing, was cleansing. And just like the maggots and leeches, it's stuck around for a reason, I think.
Well, look at FDR too, going down to Warm Springs, Georgia, and Warm Springs. So it is still a place where people are treated for cerebral palsy, even though that's not what he had. He actually, they think now, did not have polio, that he rather had Guillain-Barré disease. But anyway, Warm Springs is still a treatment center for people with cerebral palsy, even though the springs themselves are not open anymore.
Well, if you think about the things that we add to our baths, we add oils, we add salt. And I did a mineral bath in Calistoga, California, where they actually they put us in a mud and peat, and it was very hot. And then we got out and had to hose all the mud and peat off. And then they sat us in the very, very hot pools of mineral water. And we didn't get wrapped in wet sheets, but we did get wrapped in blankets and then just laid on a massage table. And I felt like Jello after. I'd had shin splints and they were gone completely. So
wow,
I feel better after a warm bath.
Yeah. So maybe there really is something to it.
Some of the other things we could leave behind, maybe.
Very reasonably priced, though, this Rochester Regional Health Springs bath.
You can get rubbed with a sheet for $25.
Yeah.
But now, speaking of things inside our bodies, we're gonna go a little deeper inside the human body now.
Yes, we are specifically going to go inside the woman's body, and we're going to talk about the wandering womb. So can everybody see my screen, or am I not sharing it? Okay, great. Let me go back and share.
There we go.
Yeah. Sorry about this. Go here. Okay. So up until the 19th century, disturbingly, perhaps even into the 20th century, it was believed that the cause of all female health problems was the fact that her uterus would detach itself and migrate around the body, right? So in the 19th century, the wandering womb began to be called hysteria. And so the theory was that a woman's womb, if it was not busy producing and bearing children, would get bored and circulate around the body looking for semen so that it could then get back to work, right? So this theory about women's health in ancient Greece, Plato described the womb as an animal capable of wreaking destruction. The word hysteria comes from the Greek word hystera, which means womb. Plato and other doctors throughout the centuries described the womb as an animal within an animal. So like I'm a woman and I'm an animal, and my womb is another animal inside me.
I don't know. Should we be flattered by that?
Well, I'm not sure. They said that when the womb became barren, it started wandering all over, causing bizarre behavior because it was so bored. And actually not being pregnant enough and not getting enough sex also made it wander all around. 17th century physician William Harvey said that women were slaves to their own biology and described the uterus as insatiable, ferocious, and animal-like. So the wandering womb became hysteria in the 19th century. The French neurologist Jean-Michel Charcot renamed it hysteria. Hysterical women were very, very, popular during the 19th century. This was frequently the diagnosis for anything that was wrong with a woman, physical or mental, or maybe if she was like just upset, right? Or angry about something. Women were considered very, very frail. very easy to fall prey to their wicked uterus going all over and causing problems in her body. So there were lots of actually therapies that were designed to get the uterus back to where it would be. So I guess they thought that the uterus had its own sense of smell.
Oh.
So they would burn incense and hold women over the incense to tempt the uterus to go back down to where it's supposed to be. When women would faint, it was thought that the uterus had gone too high in the body. So smelling salts were given to repel it back down. That's where we get smelling salts.
Oh my goodness.
Yes. Women would also sometimes have suppositories inserted with fragrant herbs to lure it back down with that those nice good smells. Women would wear uterine amulets in their underwear to keep their uterus in place. And if all else failed, men could step in and help by physically massaging the uterus back into place.
Of course.
Yes, at great personal sacrifice to them.
Huh.
You could also wear a brace, which actually kept your uterus theoretically in place. I'm not sure what that would feel like, but it doesn't look very nice.
I see it
comfortable and easy to wear.
Yeah, it says it helps with incorrect posture and misplaced organs.
Yes.
I hate that when that happens.
And it happened a lot, I guess.
It must have.
You could also use a vibrator. This was actually when the vibrator was invented because, you know, obviously, like if women are upset about something, they're just not getting stimulated enough. They're just not getting enough sex. So let's bring them to climax so they'll basically like shut up and be quiet and not cause problems. So women, this is something women actually could do themselves. But men still really wanted to be involved. So massage techniques were developed, and
that looks like an advertisement.
Yes, this is an advertisement. Mm-hmm.
Oh,
the magic power of fine, gentle massage.
The disease
in the privacy of your own home.
Oh my.
Mm-hmm. For all diseases of the mid-quarters.
Oh. I'm rendered speechless. I'm sorry.
Right? So actually, it was only our friend, yours and mine, Sigmund Freud, who began to turn around this view that hysteria was a result of the womb wandering all over when he discovered in the course of administering therapy to people, not just women, that men also had hysterical symptoms. So he determined that hysteria was actually neurological in nature. And applied to men too. So this sort of theory of the wandering womb went out of favor a little bit. But until the early 20th century, it was still believed that advanced education like learning Greek or mathematics could damage a woman's uterus. I'm not sure how. Hysteria itself was only removed from the DSM in the 1980s.
Oh.
So hysteria was still a mental diagnosis up through the 1980s.
It's striking me as such a willful ignorance of women's bodies, and something that is still perpetuated today when we look. I mean, there's several different papers and books about sort of how medical trials usually don't factor in women, don't factor in the hormone changes, they don't factor in the safety requirements of seatbelts for a woman's body versus a smaller man's body or a child's. It's really interesting how we're still, maybe not in such an extreme way as our body parts are not wandering around, but it's maddening really to think of the inherent sexism when it comes to wellness.
Well, it also speaks to, you know, the root of misogyny is fear, right? Mm-hmm. So it's like this fear of the power of a woman's body. And I don't think that we've come as far as we think we have if we look at where we are in the current political climate. When we're talking about monitoring women's pregnancies, you know, there's a whole fear that like somehow that if women are just allowed to be women and allowed to have control over their own bodies like men are, that somehow we're going to take over the world, right? And maybe that comes from the fact that like, you know, we do produce life from our bodies. We can't do it without men. So it's not like women are going to come together and take over the world and leave men behind. But it speaks to this fear and this need to actually control a woman's body, right?
That's,
Like,
yeah.
can you imagine? So this is rape. This is actual rape that we're seeing here, what this man is doing to this woman, unless he's her husband, right? I mean, even if he's her doctor, the idea that this was done like with great frequency in the 19th century.
Absolutely fascinating and terrifying.
Yeah, agree. So now let's move on to pregnancy and childbirth.
Well, excellent segue, because oh, hang on one second. Let's see. I have to pull up my slides. There we go. It's really fascinating, because when we're looking at 19th century pregnancy and childbirth, pregnancy, childbirth, and baby care dominated women's lives during this time, during many times, but we're talking in particular about the 19th century, because what other choice did they have, really? They were there to reproduce, and reproduce they did. And most women were married in their 20s, in their early 20s, and they had a baby every 2 to 3 years until menopause. So mostly into their mid to late 40s for some women. And I want to talk about the fear that came with this job, really, because of the mortality rates. In the 19th century, and this of course depended on where you lived and what care you had, but up to 30% of infants died before their first birthday, 40% did not survive past the 5th birthday, and you only had a 60% chance of surviving to adulthood after age 10. And it really, it was dangerous business. It was really dangerous business. And what you just talked about goes to show, like, with regard to the anatomy and the science of childbirth, we did not know a lot. They were not working with a lot of information. And granted, most women were having their babies with midwives. So it was women helping women that did start to shift. But there was so much we didn't know, and what women didn't know. And it was scary business. So oftentimes you didn't want to get pregnant. You wanted to reproduce, but it was a terrifying prospect. And so I have here some prevention methods of the 19th century, things that aren't shocking: withdrawal sponges, douching, barriers. The fish skin one has me cringing.
And what's vulcanized rubber?
It's rubber that's been treated a certain way. I'm not
okay.
It made me think of Star Trek, honestly.
I know, Dr. Spock.
Stirring about immediately after connection, which dancing was suggested as something to do. And even, and this is a quote, riding on horseback or over a rough road in a carriage. So you could just bounce that semen right out of you, hopefully.
Dislodge it.
Just get it right out of there. They did use the withdrawal method and like charting for their like menstrual cycles, but unfortunately did not necessarily understand what the most fertile periods were during the menstrual cycle, so they often got it wrong, which is unfortunate. This sheepskin with a ribbon condom sold for 495 pounds to a collector. I don't know if I want to know what else they collect.
Yeah,
so
you've
got a lot of women who are trying to prevent pregnancy because of the fear factor of it. And again, it's one of the only things that they're allowed to do. It truly is their job.
And imagine if they already had 5 kids. I mean, you can't, like, someone has to care for those children, right? Like,
exactly.
You know.
I mean, if you were someone of means, like the Treadwell family, you had the money to do so. You didn't have anything else to do, to be honest. You were writing letters and maybe caretaking your home, but you're seeing to your children's education. But if you didn't have means, that was even worse.
Sure.
And of course, alleviating fear was one of the main tasks of the men who worked in the medical industry or in the world. So you can see this is the wife's handbook written by Arthur here. I'm sure he knows all about being a wife, but a knowledge of health is necessary to every man and woman, but how much more so to the young wife who is entering upon the anxious period in which another life is bound upon with her own, or bound up with her own. So having been pregnant, it's scary business. You're always,
it totally is.
It's really frightening to not, and we, you know, have children in an age where we do know what's going on inside, but it's still frightening. And
and we get very good care. And I remember my body was like, it felt like a science project, like something new was happening every day, you know?
The weirdest feeling ever. But once you did get pregnant, there was this weird thing happening in the 19th century where everyone knew it was your job to get pregnant, but you couldn't really talk about it when you were, and you definitely couldn't show it, but you also still had to be, you know, a lady who was showing herself at teas or whatever. And so the fashion just sort of grew to accommodate the body in a way that was large, but this was an era of large dresses. And underneath these dresses were the corsets. And here's a couple of different, this is from the Wiley House exhibit. Now this, I love what they said on their website about this house museum. Imagine the sweat of the women that this garment contains, this maternity corset, and what their lives must have been like. There was this sort of opposing beliefs that you didn't want to squeeze the baby, but you still needed to be presentable in public. And so that's where you see these coming in, that they have the room to sort of grow with the belly. But it was immodest to be seen publicly pregnant. How dare you show us that you're doing the one thing that we've told you you're
right.
Your God-given.
I mean, that red dress, like the bustle is so big, I guess, to kind of disguise, like the bustle pops out in the back to kind of like counter her stomach popping out in the front.
Exactly. And we know going up and down the stairs at the merchant's house is arduous enough in flats and pants. Can you imagine pregnant and wearing a dress like this? I mean, that itself is dangerous.
Yeah.
So another thing that I found is there was so many traditions that were sort of quirky on the outset, but then made sense. At the first sign of labor, the hair should be parted in the middle of the back, firmly braided in two tails, because once you started labor, you were in that bed or that room or wherever you were, not only to labor through your delivery, but then you would lie in for a number of days or weeks after, where you really were not supposed to move around. And so there was diary entries of having to pick out the knots in, you know, postpartum women's hair with needles because it was so difficult. So it became a tradition to plait your hair. Now, when it comes to the actual birthing practices, look at this picture in the upper right here. You know, it's like, it's a party. They're all just holding on to her.
Well, I do see a man there. Isn't that interesting?
Questionable. Yeah, because most Victorian literature suggests that men were not allowed. Men were not even the husband in the delivery room. It was all women all the time. And you've got your chairs here. This is I'm going to tell y'all, I got this picture from a chair on eBay. So if you're really into the idea of an antique birthing chair, get yourself to eBay. This one's sold, but there might be more. But we've got the birthing chairs because this is almost a more modern sort of thing. We think often about laying in a bed is what they must have done back then, but there were a lot of different ways to get the baby out. Now, the problem is we're dealing with an era in which Christianity said that Eve's curse was for you to feel the pain of childbirth so as to bond with your infant.
Yeah.
Very little pain relief was given. And when it was given, it was usually one of these three. So you've got your laudanum, ether, and chloroform. One source that I read said, or just plain old alcohol. So I don't know if moms were doing shots of gin or whatnot, but really laboring through it without any pain relief was what was the expectation. And um the oh, I don't have the exact quote, but I was telling Matilda earlier, there was a quote from a source that said, women in labor are advised to arm themselves with patience and not yowl too loud during delivery so as not to worry their friends and loved ones.
Yeah.
So just don't get
always thinking of others, always
think of others. So in the 19th century, we're looking mostly at women assisting other women giving birth until the men start to supervise. And very quickly, that supervision of midwives turns into more patriarchal control over how birth is done. So by the 20th century, we're seeing more doctor intervention births rather than midwives. The problem being a doctor is bringing in more germs. Because again, our germ theory is not quite yet settled. And so instruments might not be as clean, hands might not be as clean. And there's really this sort of a roller coaster of infant and mother mortality as we make our way through the end of the century. And the main dangers for a woman in childbirth were prolonged birth that led to excessive bleeding and infection. And after they gave birth, they had their confinement stage where the husband could come visit, but only for about 5 minutes. And it was during this time that the mother was kept very quiet. It was thought that the baby could not receive any ill humors from anyone, no bad vibes, essentially, because they were a pure vessel from God. We had to keep them pure. And so it was this sort of perfect setting for mother to heal and baby to bond with her. Before she had to think about doing it again in a couple of years.
Right.
Now, something to bring it back to the merchant's house, our Eliza Parker Treadwell, wife to the Seabury Treadwell, when they moved into the house on 4th Street, they had 7 children. And then 7 children. And then Gertrude was born, 5 years after they moved in. And all 8 of these Treadwell children lived to adulthood.
Which is remarkable. It's remarkable given the rate of infant mortality back then.
And it's not, infant mortality, it did change depending on means, but not so much that it is rare to hear of a family with 8 children who all survived. And it's something that I always mention on the tour because I honestly, I think it must have something to do with why they were so close. They perhaps didn't experience the share of loss as siblings that so many others had. They might have known how lucky they were, but the business of childbirth obviously changes tremendously in the century to come, and even more recently now. The main point being, it was dangerous business, and really one of the only businesses you would be in if you were a woman of means.
Right. I mean, it would really, like to saying, and this whole idea of the wandering womb, and that the womb would go looking for something to do. I don't want to get too political here, but I'm seeing this mirrored in these statements about like childless women not having anything to keep them humble. Like we're returning to something that I think is very, very strange. And it's not just about abortion, it's about repressing women, because I did my whole senior thesis on the Industrial Revolution and the role of women and the repression of women, because basically men felt, the Industrial Revolution brought about a whole new set of morals, and it was very, very contrary to the moral structure of society before. So what society did was, in order to make it okay for the men to do what they were doing outside in the business world, which would go against the general moral teachings, is women were made the holders of the morals of society, right? That's why women had to be pure. That's why women had to be physically restricted with corsets and things like that. And now, like, I'm sorry, but I'm kind of feeling that again. Like, if you don't have a kid, you're not fulfilling your purpose and you have nothing to keep you humble. Like, what is that all about? I find that extrememely dangerous language.
It is shocking and dangerous, truly.
Yeah.
Well, that's my last slide. I like that we're ending with our Treadwells here.
Yeah.
Shall we?
Well, looks like we have some questions here.
Yeah, and Emily had volunteered. There's Emily.
Yeah.
Thank you both so much. That was wonderful. Just so interesting to see about how, I think one of the things we talk about a lot at the house is how aspects of the 19th century we can see reflected in how we live our lives today and what's going on in society today. And we talk a lot about that when we talk about, as we get closer to October, we talk a lot about death and mourning practices at the house. But it's just so interesting to see how sort of these, medical treatments that were so common are in some cases coming back for good and in some cases perhaps for ill.
Yeah.
So let's see if anybody has any questions, do feel free to pop them in the Q&A here. We've got time for a couple. Somebody going back to bloodletting has a question. They said that they had no idea that Washington died that way. Are there other famous people of that time that died from bloodletting? And what eventually stopped the practice of bloodletting?
So sure what eventually stopped the practice. I don't know if moving over into leech therapy maybe just kind of transitioned it. I think, medicine was evolving during that time, even though it was still extremely primitive. The idea of the four humors and the idea of germ therapy and things like that, and viruses and all that kind of stuff, this is when, like, right after Washington died is when we're starting to get into an understanding of vaccination and variolation and disease transmission and things like that. So I think the idea that disease was actually transmitted between people and not necessarily due to something internal in the body probably had something to do with it.
Matilda, it's made me too, after the Civil War, that was when, I know there might be someone in the chat who knows this. I think the Army Medical Museum started pretty shortly after the Civil War, which was when the idea of public health and knowledge of healing and medicine started to really blossom as something that the general public could consume and learn from. And so I wonder if that had anything to do with it, along with theory and the idea of just bleeding perhaps not as effective.
Right. And it's messy too.
I used to teach the Middle Ages to one of my classes, and there was a lot of talk about bloodletting.
Speaking of bloodletting, someone wants to know whether all leeches are useful candidates in leech therapy, or are there specific leeches that you use?
So there actually are two different kinds of leeches. The kind of leeches that are used in medical therapy are called H. medicinalis, I believe. There is another form of leech that does suck blood, but I don't think its saliva has the same antibacterial and healing qualities of the H. medicinalis. And as I said, leeches are now, the leeches that are used in medicine are all bred, so we're 100% sure that they are the correct form of leech.
Not something I thought I'd be hearing, talking about the correct form of leech, but
I know, but listen now, so knowledge is power. Okay. Yeah. And especially now, we all have to be responsible for our own medical care. So actually knowing about these kind of alternative therapies is good. Maybe you might request it sometime. Yeah. You don't know.
I was just wondering what my healthcare would say if I was like,
or is it covered by insurance? That's my question.
Yeah. One thing I was just really struck by too in your conversation this evening is how often these things overlap. I mean, as you were saying, Ashley, that, Roebling injures himself, and that maybe if he had opted for maggot therapy in addition to his water therapy, that might have been a useful thing for him. And even too, thinking about sort of this medicalization of childbirth, that we start to see sort of the same doctors who are using leeches and maggots on people suddenly putting their hands, going from say surgery where they're using leeches to delivering a baby, and the issues that were caused there.
Yeah, absolutely.
Let's see, a couple more questions. Somebody asks whether are leeches actually used in hospitals?
Yes, they are. They are.
Yeah.
Ashley has a story about this.
I do.
Actually.
So
very
actually,
prescient.
a friend of mine, her sister's a trauma nurse in the ER, and she was texting with her sister, and her sister said some guy chopped off his fingers. We were able to reattach 2 of them. We used leeches because the blood flow wasn't doing what it needed to. And my friend didn't believe her, and she said, send me a picture. And she sent a picture of the leeches in their jar, not on the patient, because bad news. But I was shocked. I had no idea. And then a week later, I'm talking to Matilda about that exact thing. So there you go.
Fabulous. Let's see, one last question. Someone wants to know, what books or resources would you recommend to learn more about these medical practices?
So that's very interesting. There is a doctor, let me see if I can look up her name. She's written a couple of books. Actually, she's a medical historian. Her name.
While you're looking, Matilda, I'll say that the book that I found so much interesting info from it's called Water Cure for Ladies. It's not just about the water cure. There's chapters on all sorts of women's health from the 19th century. And it was one of those things that I actually did bookmark to go back and read more of later as the giant history nerd that I am. Because it's equal parts dumbfounding and fascinating. It has to do with like the various meats you should eat on this time of the year for gut health or whatever the 19th century version of that was.
I'm not finding her name. If you just Google any of these things, leeches, maggots, wandering womb, you'll come up with all kinds of, there are a number of books on older medical practices. And you'll also come across, in terms of contemporary practice, some medical journal articles that are available that talk about, that'll give you a little bit of the history of the use of leeches and maggots and how they're used today.
You can take it back really far, all the way to the 12th century. Hildegard von Bingen was the prophetic nun who published one of the first science journals about healing herbs, but she's also known as one of the first women who, with the blessing of the Catholic Church, wrote scientifically about women's orgasms.
Wow.
For science.
I can actually add 2 recommendations to this too. I can recommend, there's a wonderful podcast called This Podcast Will Kill You that talks about each episode is about a different disease, but they often talk about sort of the history of the ailment, which is a really fascinating podcast. So if people are interested in that. And then I can also recommend taking a look at the Merchant's House blog. Museum historian has written a number of posts about various medical things. So you can dig back through the archives and see some more information there. So those are my 2 recommendations.
I didn't know about Julia going for the water cure until I found that on the website.
Well, wonderful. This was just so fabulous. I think that's all the time that we have for this evening. But thank you both so much.
Yeah, thank you, Emily.
As you in the audience may know, the Merchant's House is Manhattan's most haunted house, and we are coming up to October. This year, we are celebrating our 20th anniversary of Candlelight Ghost Tours at the Merchant's House. So you can join me and Ashley and Matilda to explore the house by candlelight and hear some true tales of ghostly encounters, as well as the results of paranormal investigations at the house. Tickets to our Candlelight Ghost Tours and all of our upcoming events can be found on our website at merchantshouse.org. Village Preservation also, of course, has a robust roster of programming. You can see their full calendar at villagepreservation.org. The Merchants House is currently open to visitors on Wednesdays, Thursdays, Fridays, Saturdays, and Sundays, with options for both guided and self-guided tours. You can visit our website at merchantshouse.org for tickets and more information. Tonight's talk was presented free of charge, but we do hope that you will consider making a donation or joining us as a member to support our future programming. Recordings of all of our virtual talks can be found on our YouTube page at youtube.com/merchantshousemuseum. And again, if you haven't already, please do consider submitting a letter to support the museum in our fight against development next door. So thank you everyone for joining us this evening. Thank you again to Ashley and to Matilda for this wonderful presentation, and have a wonderful night, everybody.
Thanks, everyone. Bye.